My name is Dr. Joe Chablis. I'm the Medical Director of Metabolic and Bariatric Surgery at Lakeland Regional Health. We're excited to offer patients a wide range of options with regard to their bariatric care. At Lakeland Regional Health, we offer a variety of metabolic and bariatric surgery interventions tailored to the patient's needs. The most commonly performed surgeries are the laparoscopic vertical sleeve gastrectomy, commonly known as the sleeve, the gastric bypass, the duodenal switch, adjustable gastric band, the endoscopic balloon, and revisional bariatric surgeries. In the ideal scenario, we see our patients, we get to learn about them and understand their disease states, and we can help tailor the appropriate operation to those patients. For myself personally, when I educate patients, I'm concerning myself with three things. What is the body mass index of the patient? For those patients whose body mass index is 50 or higher, that's an important consideration. Is the patient a diabetic? And specifically, are there diabetic patients who've had long-standing diabetes? Do they require insulin? Is their diabetes poorly controlled? And thirdly, do they have significant acid reflux? This is an operation that involves a removal of about 80% of the stomach. And it's not just about making the stomach smaller. There are important metabolic hormonal changes that occur as a consequence of that. Sometimes the sleeve is the only operation we can offer a certain group of patients. The sleeve is very useful for patients who have very complex abdominal wall hernias, patients with inflammatory bowel disease, patients with Crohn's disease. It's also extremely useful in the pre-transplant patient. So in the patient who's pre-liver transplant or pre-kidney transplant, this is an extremely desirable operation. But it's not just the complex patient that the sleeve is useful in. We have a lot of patients living in Florida who are of advanced age and who need certain medications that could potentially cause ulceration problems in other types of surgeries we do. The advantage of the sleeve is that there's no intestinal reconstruction. I mean, fundamentally what we're doing is just removing a portion of the stomach. And I think there's something about that that's more acceptable to patients. And perhaps that's the reason why the sleeve has become so popular over the last decade. So in a gastric bypass, a thumb-sized reservoir of stomach is created and a small intestinal reconstruction is performed. With a gastric bypass, there is a superior result with regard to weight loss, the reduction of one's body mass index, as well as the improvement or remission, as we say, of diabetes, high blood pressure, sleep apnea, and lipid problems. Now, the disadvantage of the gastric bypass is that we have to be careful not to choose this operation for patients who are on medications that could cause ulcerations. The other big disadvantage of gastric bypass, although small, there is a lifetime risk of a special type of intestinal obstruction called an internal hernia. There can be significant iron deficiency in a segment of the patients. We have generally, as a society, performed less and less of these operations over time. The reason why the band has really fallen out of our favor is because this is really just a restriction or portion limitation operation. It doesn't involve any type of hormonal metabolic benefit to the patient. And also fundamentally for patients who seek the band for weight loss, in general, over almost 2 decades now of data, we have found that the band is not a great operation as far as its ability to help people lose weight. So as a result, we have seen that most of the patients who in the mid-2000s were seeking bands are primarily looking at other operations. So the duodenal switch is an operation that involves the sleeve gastrectomy reservoir as the portion of the stomach that's left behind, as well as an intestinal reconstruction. In contrast to gastric bypass, which has a similar type of setup, which is a reservoir and intestinal reconstruction, the amount of intestine that's bypassed in a duodenal switch is much longer. This is an excellent operation when it comes to weight loss. It's an excellent operation in terms of how it performs for people in disease improvement and remission, and specifically in diabetes. So we also at Lakeland Regional Health offer the endoscopic balloon. Ideally, the best candidate for a gastric balloon would be someone with a body mass index between 30 and 35 without diabetes. The operation is done endoscopically, it doesn't involve any incisions, with the placement of a balloon that's to remain for 6 months. It's really intended for someone with mild or early obesity as a way to help them become healthier and to lose 20 to 30 pounds. We tell people that metabolic and bariatric surgery is as safe or safer than gallbladder surgery or hysterectomy, which are commonly performed procedures all over the United States on a daily basis. So we want people to understand that we no longer consider these operations to be, quote, drastic or dangerous. These are critically important operations that eradicate disease, save life, and extend life. And we need to make sure the patients, and maybe even more importantly, some of my physician colleagues, to understand they should feel very comfortable referring patients for bariatric surgery.